We maybe. No, this doesn't really happen, but, okay, guys, ready? Here we go. Inside, this is the inside of the pelvis, all right? This would be the top of the iliac crest. All right, so this is inside. So what covers the inside surface of the coxal bone? We just did it on our test. Notice the silence. Okay, they just had an exam on this. What is this muscle called? Yes, it's called the iliacus. Very good. Iliacus. Yeah, we just had it on the model there. Iliacus covers the.
I left that one blank.
Right, and over here would be the psoas. Okay, and the iliacus come together, and here's where they come out. This would be the inguinal ligament here. And this is where they come onto the femur. That's the iliopsoas. They blend together to create what's known as the iliopsoas, hip flexor. All right? This is missing something. Do we have it on here? Do any of these have it? Yes, this guy. Okay. All right. So I guess we'll start with the lateral aspect, okay? So here's the iliac crest. There's some muscle tissue and tendinous tissue on the side of the leg. What it's going to do is abduct, move the leg away from the body. This is the tensa fascia lata. It inserts into this big gray band, that's the iliotibial tract. And it attaches below the knee. Okay? That's what you really pretty much see on the side. If we go around to the back, your favorite muscle, gluteus maximus. All right? That also inserts into the iliotibial tract. Gluteus maximus, hip extensor, extends the leg at the hip. Okay, pull that off. Yeah, extension. Underneath the glute max is three glute muscles. Gluteus maximus, gluteus medius, and if we were to cut that away and look underneath that, there would be a gluteus minimus. There's three glutes, but our model doesn't only show us the max and the medius. Right. If you see this nerve, that's the sciatic nerve. The muscle always above the nerve is the piriformis. Right? The piriformis. So we're getting into the rotators now. And then there's 1, 2, 3, 4 muscles here. They're small, 1, 2, 3, and then the larger one, 4 here. These are the ones you were writing in. Superior gemellus, obturator internus, and inferior gemellus. Okay. And then the quadratus femoris. Those are the 4 that you wrote in. Okay, we don't see the externus. So, piriformis, the 2 gemelli, the 2 obturators, and the quadratus femoris, they're all rotators. They rotate your hip, just like the rotator cuff of the arm. Some, they each has its own, function, but for the most part, they're the rotators. So that's deep to the glute. If we move to the back of the leg, this is known as the hamstring glute. All right, there's 3 muscles, 1, 2, and this little one underneath here, 3. All right. This is the biceps femoris, like the biceps brachii of the arm. That is dead. It's a biceps, meaning it has 2 heads to it, right? Here's the other head right in here. Okay. So this is part of the same muscle here, biceps femoris. And these are two separate muscles, this one and this one. Okay. Now I think these, you had pictures of these in your book, right, or no? You have the hamstring group? No. Look back, should be,
I've seen them somewhere.
I think it's, you passed it. Should be right there. Semimembranosus, semitendinosus,
Yeah.
and biceps
It's
femoris.
on the big tall one.
Right.
Full
But
body.
you have this picture here. This is where we are. We just took the glute max off, right? See that? All right. And then you said the biceps femoris. You
Yeah,
see
it's on
that?
here.
Long head, short head. Okay. Long head, short head. And then we're here. See these two? Semimembranosus and tendinosus. Okay. Which one is this? Superficial. No. So we have the semimembranosus and tendinosus. Which is the superficial one? Which is the one that's above the other?
Membranosus.
Membranosus. And
It doesn't look like that.
Yeah.
It looks like the tendinosus is over.
this one here. Okay, well, yeah, your book is a little confusing, isn't it? This one is superior to this one.
The membranosus is
Semimembranosus over the semitendinosus. Semimembranosus over the semitendinosus. In your book, yeah, the pictures in the book leave a lot to be desired, right? That's why we work with the models.
Yeah, once.
Okay, so you have 3 in the group. 1, 2, 3 in the hamstring group. Okay, and they flex the knee. Flex the knee. Okay, so we had the lateral, tensor fasciae lata and iliotibial tract or band. The hamstring group, biceps femoris, semitendinosus and membranosus. We had the glute max, the glute medius, the rotators, piriformis, gemelli, one of the obturators, quadratus femoris. If you go to the front of the leg, okay, that's the quadriceps group, quad meaning 4. There's 4 parts to it, one underneath. This is the medial side, toe, this medialis. This is the lateral side, little toe, vastus lateralis. This is the rectus femoris. Not this exclude, no. Is where vastus intermedius is. Vastus intermedius. Vastus medialis, vastus intermedius, vastus lateralis, and above it, the rectus femoris. It does feel like it was glued a little bit. Okay, that's your quadrant. That extends the knee. Extension at the knee. Straightens the leg. Then you have what's medial. This is called the adductor group. It brings your leg back towards the midline. And you have, I don't know if you even saw this in our picture. I think it should be there. Don't think we highlighted it, but you should. The sartorius. This is the sartorius. It's a little ribbon-shaped muscle. It starts laterally, here, the tensor fasciae lata, and it wraps around the front and goes medially. So it crisscrosses from lateral to medial. So it's a little wacky. It's like the latissimus dorsi. It goes from here around to the front, from back around to the front. It goes from medial around the front, from lateral around the front to medial. The latissimus dorsi did a whole bunch of things for us, right? It had extension and internal rotation. This is similar, right? This does a little bit of flexion a little external rotation and a little abduction. It's the one that allows us to sit cross-legged on the floor. So it kind of does three things at the hip joint. It brings our leg into that cross-leg position. So it's kind of similar to the lat in that way, because it crosses from one side to another. Sartorius. Running right down the side is the gracilis. All of this here, I don't know how the numbers are, if people just wrote, I can't really see the numbers that well, but all of this here is adductor magnus. That's the biggest one. It spans the whole area. It's the magnus. This is the longus, adductor longus. And this is a little tricky area here because the brevis is just this little slip right here. Just that little slip. The muscle that's deep in there is the brevis. And this is the pectineus. Pectineus, the brevis is in there, the longus, and the magnus.
Okay.
There. Gracilis and sartorius. And that's what we're going to see up here, and we'll hit them again next time that we're together, in a little bit more detail. And then we have the lower. Alright, is everything here? Let's go. The posterior compartment is the gastrocnemius, which is these two heads. Gastrocnemius right here. And it inserts into the calcaneal tendon, or Achilles tendon. Gastrocnemius. These are very powerful muscles. Gastrocnemius and the muscle under it, the soleus, very powerful. Why do I say they're powerful? Because they can lift your full body weight, all 450 pounds, right up on the toes. Right? You can go up on your toes very easily. That's this. Very powerful muscle.